Welcome to Quick MCAT Lessons, where I try to explain MCAT topics in 10 minutes or less. Today, we're going to be going over blood clotting, or hemostasis. This is the physiological process that stops bleeding following vascular injury. It occurs in three major phases: vascular spasm, platelet plug formation, which is primary hemostasis, and the coagulation cascade, which is secondary hemostasis. Initially, vascular injury leads to immediate vasoconstriction to reduce blood flow. This is followed by the formation of a platelet plug at the site of a damage, and finally a stable fibrin clot is formed through the coagulation cascade. So let's start with primary hemostasis, which is platelet plug formation. So primary hemostasis begins when endothelial injury exposes subendothelial collagen and von Willebrand factor, or VWF. This attracts and binds circulating platelets via the GPIB receptor. Once adhered, platelets become activated and release chemical mediators such as ADP, thromboxane A2, and serotonin. These in turn recruit additional platelets to the site. These platelets aggregate through fibrinogen bridges formed between GP2B and GP3A receptors on their surfaces. This creates a temporary platelet plug. Now, you should know that platelets are fragments of megakaryocytes, and aspirin works by inhibiting thromboxane A2 synthesis, which impairs aggregation. Now, let's move on to secondary hemostasis. This is the coagulation cascade, which is a complex series of biochemical reactions that leads to the formation of a stable blood clot, which is essential for stopping bleeding. Now, this involves a tightly regulated interplay between clotting factors, which are mostly proteolytic enzymes that are circulating in the plasma in their inactive or zymogen form. The cascade is traditionally divided into three interconnected pathways: the intrinsic, the extrinsic, and the common pathway. The intrinsic and extrinsic pathways both converge onto the common pathway. So let's start with the extrinsic pathway. The extrinsic pathway is triggered by external trauma that causes blood to escape from the vascular system. It begins when a membrane-bound glycoprotein found on subendothelial cells, called tissue factor, is exposed to the blood. Tissue factor binds to and activates to factor 7 and makes that into factor 7A. This then activates factor 10 to factor 10A in the common pathway. This pathway is fast and acts as the primary initiator of coagulation in vivo. The intrinsic pathway, in contrast, is activated by trauma inside the vascular system, such as exposed endothelial collagen or activated platelets. It involves sequential activation of factors 12, 11, 9, and 8. Factor 9A, along with its cofactor 8A, activates factor 10. That's how this pathway is linked to the common pathway. Now, although the intrinsic pathway is slower than the extrinsic pathway, it amplifies the clotting response. And so the common pathway starts with 10A, and recall that factor 10A comes from both the extrinsic and intrinsic pathways we went over, but once you have factor 10A, you're in the common pathway. This is in a complex with its cofactor 5A, which is the prothrombinase complex. This converts prothrombin, which is factor 2, into thrombin, which is factor 2A. Thrombin then converts fibrinogen, which is factor 1, into fibrin monomers. Thrombin also activates factor 13. Factor 13 cross-links fibrin strands to form a stable, insoluble clot. Additionally, thrombin provides positive feedback by activating upstream factors like factor 5, factor 8, and factor 11 to further accelerate clotting. Now, regulation is crucial to prevent excessive clot formation. Natural anticoagulants like antithrombin 3, protein C, and protein S inhibit various steps in the cascade. Now, all clotting factors are synthesized in the liver, and factors 2, 7, 9, and 10 require vitamin K for their production. Warfarin, a common drug and an anticoagulant, inhibits vitamin K recycling, and heparin enhances antithrombin 3, which is a protein that inhibits thrombin and factor Xa. This is why heparin and warfarin are common anticoagulants given to patients. Now, another important process is fibrinolysis, which is the breakdown of clots. This occurs when tissue plasminogen activator, or TPA, converts plasminogen into plasmin. Plasmin digests fibrin, dissolving the clot. Medications like alteplase, which is a form of TPA, are used clinically to dissolve clots in ischemic stroke. Now that's it for today. Next time we'll go over some practice questions regarding the kidney, the skin, and clotting.